Good morning or good day. So today we'll talk about specimen collection. Okay, so let's start our discussion regarding specimen collection. Okay, so first is the duty of a phlebotomist. So first duty of a phlebotomist is to collect blood specimen. Okay, so that's the first duty of a phlebotomist to collect specimen. Okay. Next, the phlebotomist should also be familiar with the different equipment and devices available in the laboratory so that he or she can choose properly the appropriate um, device or equipment for a certain condition of the patient's vein. Okay. And another, to be familiar with the type and amount of specimen required for the test. Okay, so those are the duties of a phlebotomist. Then next, you have the supplies and equipment that are important in blood collection. So general blood collection equipment and supplies. So first is the blood drawing station or the phlebotomy area or phlebotomy section. So it is a dedicated area of a medical laboratory or clinic equipped for performing procedures on um, primarily outpatients, okay, primarily outpatients sent by their physicians for laboratory testing. So regarding the use of phlebotomy area or phlebotomy section, it's used for the collection. Okay, that area is allotted for the collection of specimen particularly from outpatients, okay, not from confined or inpatients, because for inpatients we or the phlebotomists usually draw blood uh, or perform phlebotomy inside patient's room. Okay, so that's for outpatients, but for no, that is for inpatients, but for outpatients phlebotomy is performed in the blood drawing station or phlebotomy area. Okay. Another thing regarding blood drawing station, there's also a table for supplies. Okay. Another, you have a special chair where the patient sits during blood collection procedure. Then another is bed or reclining chair for patients with history of fainting or persons donating blood and other special situations. Okay. So that's the first material or equipment or supply, or it's not equipment or supply, it's a portion of the laboratory designated for blood collection. Then next, you have phlebotomy chairs. So for phlebotomy chairs, it should be comfortable for the patient and have adjustable armrests to achieve proper positioning of either arm. And most have adjustable armrests that lock in place to prevent the patient from falling should fainting occur. So another important thing or equipment or laboratory furniture in a phlebotomy area, it's the phlebotomy chair. Okay, and it should have an armrest. Okay, so that you can position the arm properly. Okay, so you can get the proper positioning of patient's arm. Okay. Then next you have equipment carriers. So equipment carriers make blood collection equipment portable. So meaning the use of equipment carriers is to transport blood collection equipment. Okay. So example, you're going to carry or transport evacuated tubes, your needles, syringe, labels, and other containers of specimen. Then you have your infectious waste container, sharps container. So to carry all those materials, you need an equipment carrier. Okay. So this is especially important in a hospital setting and other instances in which the patient cannot come to the laboratory. Okay. So example of uh, equipment carriers, you have the handheld carriers. And for handheld carriers, you have trays or the phlebotomy tray or warding tray. Okay, so it comes in a variety of styles and sizes designed to be easily carried by the phlebotomist and to contain enough equipment for numerous blood draws. And it should be convenient for stat, so it's not that bulky, so that you can bring this easily, and it's convenient for stat or emergency situation. So this is an example of of a handheld carrier. So you have your tubes, evacuated tubes, then you have your tourniquet, lancets, syringe, okay? And it also contains a container of infectious waste, okay? So that's for your handheld carrier or your phlebotomy tray or warding tray, okay? Another equipment carrier, you have phlebotomy cart. So for phlebotomy carts, typically made up of stainless steel or strong synthetic material, and they have swivel wheels which glide carts smoothly and quietly down hospital hallways and in and out of elevators. Then they normally have several shelves to carry adequate okay shelves to carry adequate supplies for obtaining blood specimens from many patients. And carts are commonly used for early morning hospital phlebotomy rounds when many patients need lab work. Okay, so carts are bulky and a potential source of nosocomial infection. That's why you're not allowed to carry or to bring the phlebotomy cart inside the patient's room. So your phlebotomy cart must also carry the warding tray, because in order for you to bring materials from the phlebotomy cart, which is located or parked outside the patient's room, you need to use your warding tray. Okay, so that's the purpose of your phlebotomy cart and your warding tray or phlebotomy tray. Okay, so meaning of nosocomial infection, hospital acquired. Okay, so that's for uh, equipment carrier. Okay, so you have phlebotomy carts and phlebotomy tray or warding tray. Okay, so next supply, it's gloves. A new pair must be used for each patient. Okay, and be removed when the procedure is complete. Okay, and the protocol is to use one pair of gloves for one patient or per patient. Okay, so a good fit is essential. So choose the size that fits your hand properly. And with gloves, there are gloves with powder, and gloves with powder are not recommended because the gloves, no, the powder, for example, latex, it usually causes contamination to your specimen. And another thing is there are individuals who are sensitive to latex. So that's why for gloves we usually use nitrile gloves. Next, for antiseptics, so substances used to prevent sepsis. So when you say sepsis, it's the presence of microorganisms or their toxic products within the bloodstream. So it prevent or inhibit the growth and development of microorganisms, but do not necessarily kill them. So another thing about antiseptic, it's considered safe to use on human skin, and it's used to clean the site prior to blood collection. And the most commonly used antiseptic is 70% isopropyl alcohol. Okay. Now, if we want to use antiseptic with high degree of antisepsis, then use povidone iodine. But the thing about povidone iodine, there are some individuals who are sensitive to iodine. Okay. So there's an alternative to that, and we'll discuss that in the next slide. So regarding antiseptics used in blood collection, So first you have 70% ethyl and 70% isopropyl alcohol. Okay. Another, you have benzalkonium chloride. So for benzalkonium chloride, this is for ethanol or alcohol testing. Okay, so if you want to measure the levels of alcohol in blood, then you're not allowed to use isopropyl or ethyl alcohol as antiseptic. Okay, so the ideal is to use benzalkonium chloride as the antiseptic for ethanol or for the collection of specimen for ethanol testing. Okay, and another, you have chlorhexidine gluconate. So for chlorhexidine gluconate, this is the alternative to iodine because there are people who are sensitive to iodine. So the alternative is to use chlorhexidine gluconate. And you can also use this one for infants because usually infants are sensitive to iodine. Okay, so chlorhexidine gluconate. Another, you have hydrogen peroxide. Then you have povidone iodine and tincture of iodine. So these are the antiseptics used in blood collection. Okay, so next you have disinfectants. So for disinfectants, chemical substances or solutions used to remove or kill microorganisms on surfaces and instruments. They are typically corrosive and are not safe to use in human skin. So example of disinfectant, it's sodium hypochlorite. So when you say disinfectant, you have your sodium hypochlorite. That's it. The use is to decontaminate or disinfect the working area or the equipment, and for cleaning the venipuncture site, that's your antiseptic. Okay. Okay, so next supply have hand sanitizers. So CDC recommends the use of alcohol-based hand sanitizers for routine decontamination of hands as a substitute for hand washing, provided that hands are not visibly soiled. The next, you have gauze pad and cotton balls. So used to hold pressure over the site following blood collection procedures or to stop the bleeding. Okay, but the problem or between the two, the preferred material is gauze pad because for cotton balls, there's a tendency for cotton balls to stick to the site, and that can cause or that reinitiate bleeding. Okay, so that's the problem with cotton balls. So ideal or preferred is gauze pad. Okay, the next is bandages. So used to cover a blood collection site after the bleeding has stopped. The next, you have needle and sharps container. Okay, so for needle and sharps disposal containers, so used needles, lancets, and other sharp objects must be disposed of immediately in special containers referred to as sharps containers. So regarding the characteristics of sharps containers or sharp containers, so it's clearly marked with biohazard symbol. It's rigid, puncture resistant, leak proof, disposable, and have locking lids. Okay. Then next, biohazard bags. So for biohazard bags, these are leak-proof plastic bags that are commonly used to transport blood and other specimens from the collection site to the laboratory. Then next, you have slides. So slides used to make blood films or blood smear for hematology determinations or hematology tests like CBC. And regarding slides, there are two types of slides. You have plain and with frosted area or frosted slides. The nice thing about slides with frosted area, you can actually put the label on the frosted area using pencil. Okay, so that's the advantage of using a slide with frosted area. The next, you have pen. So a phlebotomy should always carry a pen with indelible or permanent non-smear ink to label tubes and record other patient information. So you need a pen for labeling. So in labeling the specimen, you need to write down the patient's name, full name, the date of birth, and also the time and date of collection. Okay. The next is watch. So for watch, A watch, preferably with a sweep second hand or timer, is needed to accurately determine specimen collection times and time certain tests. Okay, so uh, in the labeling of specimen, you need to write the time of collection. That's why you need to have a watch to indicate the time of collection and also to time certain tests like mga clotting time, bleeding time. So that's the use of watch. Okay. Okay. So next we'll talk about the equipment necessary for venipuncture. Okay. So let's start with vein locating devices or trans illumination devices. So the purpose of trans illumination devices is to locate, okay? So to locate veins, okay? So locate veins, okay? So that's the purpose of our vein locating devices, okay? Now, the principle, okay, of vein locating device. So regarding vein locating device, vein locating device or it emits high intensity LED light. Okay, high intensity LED light. Now, regarding the blood vessel, okay, our blood vessel. So our blood vessel contains blood, and one of the components of our blood it's the cellular component. An example of cellular component present in our blood it's your RBC. Now, the RBC contains hemoglobin. Okay, so the hemoglobin, okay, present inside the RBC absorbs the light from the vein locator. So after the absorption of light, okay, so after hemoglobin absorbs light, then the area with hemoglobin, that's our blood vessel, okay, like this one. So you have dark area, okay. So these dark areas are the blood vessel, okay. So ni dark sila, it's because of the absorption of light, okay, by the hemoglobin present in the red blood cells, okay. So that's the principle, okay, of vein locating device or vein locator. Okay, so next you have tourniquet. So for tourniquet, it's a device that is applied or tied around a patient's arm prior to venipuncture to restrict blood flow. Okay, and a properly applied tourniquet is tight enough to restrict venous flow out of the area, but not so tight as to restrict arterial flow. Okay, because we want to avoid anaerobiosis, okay, or the absence of oxygen. Okay, now regarding tourniquet, the restriction of venous flow, okay, this one, okay, restriction of venous flow distends the vein, okay, or inflates the vein, okay. So there's inflation of the vein or distend, okay, distend the vein or to cause inflation or inflates the vein. So in that way, it's easy for the phlebotomist to palpate, to locate the vein, okay, and since the blood vessel it's inflated, so meaning the wall of that blood vessel is thinner, so it's easy to pierce that using a needle. Okay, so that's the purpose of your tourniquet application. Now, uh, a tourniquet must fasten in a way that is easy to release with one hand during blood collection procedures or in emergency situations. Okay, so the most common type, a strap tourniquet, is a flat strip of stretchable material such as latex, nitrile, vinyl that is fairly inexpensive and disposable. Okay, so those are some of the characteristics of a tourniquet or type of tourniquet. Okay, so next is regarding the use of tourniquet. Um, you can usually reuse tourniquet. You can reuse tourniquet if it's not soiled with blood, it's not contaminated with blood, or there's no visible contamination. Okay, But if there's visible contamination, then you need to throw that one or discard that tourniquet. Okay. Next, a blood pressure cuff may be used in place of tourniquet. So if you're going to use uh, blood pressure cuff as tourniquet, then you can inflate that or you can inflate the blood pressure cuff at 40 mmHg. Okay, not more than 40 mmHg. So that's the maximum. Then a number of studies have shown that reusable tourniquets have the potential to transmit bacteria, including methicillin-resistant Staphylococcus aureus. Now, because of this possibility to transmit MRSA, that's why it's advisable to use, okay, disposable tourniquet, okay, or meaning single-use tourniquet, okay. But there's no such organization or institution that uh, um, required all laboratories to follow that rule. Okay, that's why there are a lot of laboratories that they usually reuse their tourniquet. So they are going to dispose the tourniquet once it's contaminated with blood. But if not, they can reuse it. Okay, but that's why there's an advice or uh, finding manggut nga, there's a possibility of transmission or transmission of methicillin-resistant staph aureus due to reusing or reuse of tourniquet. So institutions or laboratories have an option not to reuse or reuse sila, but it's up to them. Okay? Ang best is not to reuse the tourniquet. Okay? To avoid the transmission of MRSA. Okay, so next you have needles for venipuncture. So first, characteristics of a needle used in venipuncture. It's sterile, disposable, so it's designed for a single use only. And regarding types of needles used for venipuncture, you have multi-sample. So this is an example of multi-sample needle. Okay, this one. So multi-sample needle is the needle used in ETS or evacuated tube system. The next you have hypodermic needle. Hypodermic needle is the needle used in syringe method or the needle in syringe. Okay, that is a hypodermic needle. Then last you have wing infusion needles or butterfly needles or butterfly infusion needle. So this one is example of butterfly needle. Okay. So it's important to visually inspect a needle prior to venipuncture. So inspect defects such as blocked, blunt, or bent tips and rough bevels or shafts that could injure a patient's vein. Now, regarding the parts of a needle, you have three main parts. You have the bevel. Okay, so this one is the bevel. Okay, so beveled or cut on slant. So the purpose of bevel is to pierce the vein. Okay. Shaft, so this is the shaft, okay, of the needle. So long cylindrical portion, and the lumen is the internal space of the needle or the internal portion, okay, of a needle. That is the lumen. Okay, so that's for the parts of a needle. Next, you have gauges. So gauges, a needle's diameter and gauge have an inverse relationship. So remember, gauge and size of the needle, the smaller the gauge, the bigger the needle. So example, if we're going to compare gauge 16 versus gauge 23, ang bigger nga needle is 16, ang small, it's 23. Okay? So although blood typically flows more quickly through large diameter needles, needle gauge is selected according to the size and condition of patient's vein, the type of procedure, and the equipment being used. Now next, you have 15 to 17. Regarding gauges, you have 15 to 17. So it's a special needle attached to collection bag. So it's usually used for blood donation. Okay, so collection of donor units, autologous blood donation, and therapeutic phlebotomy. So example of therapeutic phlebotomy in cases of polycythemia vera. So in polycythemia vera, there is increase count of RBC, abnormally high RBC count. So one of the management or ways to manage polycythemia vera is to remove some of the RBCs through therapeutic phlebotomy. Okay, so that's for gauge 15 to 17. Okay, then next you have 18. So it's usually present in hypodermic needles and it's used primarily as transfer needle rather than blood collection. And next you have 20. So there are multi-sample needle with gauge 20 or gauge 20 multi-sample needle. Then also for hypodermic or syringe. So sometimes used when large volume tubes are collected or large volume syringes are used in patients with normal size veins. So you can usually use 20 or it's not the standard size, but you can use 20 for patients with normal size veins, okay? Or they have big veins. Next, you have 21. So there are 21 gauge multi-sample needle and also hypodermic. And it's considered the standard venipuncture needle for routine venipuncture in patients with normal veins or for syringe blood culture collection. Then next, 22. So for 22, there are 22 gauge multi-sample needle and also hypodermic and used on older children and adult patients with small veins or for syringe draws on more difficult veins. And last, you have 23, butterfly. And also, there is a 23 gauge hypodermic needle, okay, or syringe. So it's used on the veins of infants and children and on difficult or hand veins of adults. So if you want to collect blood from here, then it's best to use gauge 23 needle. So gauge 23 syringe or your butterfly infusion set. But between the two, the ideal, it's a butterfly infusion set. Okay. So next you have the color coding of gauges. So for color coding, for multi-sample needle, it's in the cover. So for example, this one, cover, cover, cover. Then for syringe, it's the hub, color of the hub. Okay. And for butterfly infusion set, you have the wings. Okay. This one. Now, if the color of the cover of a multi-sample needle it's yellow, then that is gauge 20. So this one it's gauge 20. If green, like this one, it's 21. If black, like this one, it's 22. Then for blue, like this one, blue nga wings or blue nga hub, then that means that the gauge of these needles it's 23. Okay, so that's for the color coding of needle gauges. Okay, so for multi-sample needle, you have the cover. For syringe, you have the hub. So if the color of the hub of a syringe is green, then meaning the needle or needle gauge it's 21. Okay, if black, then that is 22. But usually it's 21 or 23. Common, it's 23 for syringe. Okay, so that's why for the collection of specimen from this area, you can use syringe or the butterfly infusion set. Okay, so the gauge is 23. Okay, so next is the length of the needle. So for multi-sample and syringe, it's usually from 1 to 1.5 inches. And for butterfly, it's 1/2 to 3/4 inch. Okay. So next you have safety features of the needles. The needles are available with or without safety features. Example of safety features is like this one. So for butterfly infusion set, after collection, you can push this yellow part of the butterfly infusion set, and the purpose of that is to cover, okay, to cover the needle after collection. Okay, so push this one, and in that way, it will prevent needle stick injury. Another example is this one. So safety needle. So after collection, just push this one to cover the needle. Okay, so to avoid needle stick injury. So safety features must provide immediate permanent containment and be activated using one hand, which must stay behind the needle at all times. Safety features include resheathing devices such as shields that cover the needle after use, blunting devices, and equipment with devices that retract the needle after use. So those are some of the safety features for needles with safety features. Okay. Then next you have evacuated tube system. So evacuated tube system is the most common and efficient system, and it's preferred by the CLSI for collecting blood samples. So remember, when I say evacuated tube system, it's a closed system. Okay. For syringe, that is the open system, in which the patient's blood flows through a needle inserted into a vein and then directly into a collection tube without being exposed to the air or outside contaminants. The system allows numerous tubes to be collected without a single venipuncture. So the nice thing about evacuated tube, you can prevent contamination because the sample will not be exposed to air or outside environment. Okay, so that's why it's a closed system. Now the three basic components of ETS, you have the needle, the holder or the adapter, and the evacuated tube. So you have the needle with safety feature or safety shield. So this is an example of safety needle. Then you have the holder and the evacuated tube. Okay, so that's those are the three components. So three main components. You have the needle, the holder, and the evacuated tube. But there are some needles with safety feature like this one. Okay, so safety shield or so that's an example of a safety needle. Okay, so basic components, you have needle, holder, and the tube. That's for ETS. Okay, so for multi-sample needles, ETS needles are called multi-sample needles, and it allows multiple tubes of blood to be collected during a single venipuncture. And for tube holders, a tube holder is a clear plastic disposable cylinder with a small threaded opening at one end where the needle is screwed into it and a large opening at the other end where the collection tube is placed. The large end has flanges or extensions on the sides that aid in tube placement and removal. Then next, regarding evacuated tubes, used with both ETS and syringe method of obtaining blood specimens. So remember, for ETS and syringe, you also need ETS tubes or evacuated tubes in syringe method because you need to transfer blood from syringe to your evacuated tube. Okay, so tube selection is based on the age of the patient. So regarding the volume, there are underfilled tube. There are tubes that are designed to collect less blood volume, the amount of blood needed for the test, and the size and condition of the patient's vein. Okay. Next, you have the vacuum. So evacuated tubes fill with blood automatically because there is vacuum in them. The vacuum is artificially created by pulling air from the tube. The amount of vacuum is measured precisely by the manufacturer so that the tube will draw the exact volume of blood indicated on the label. To reach its stated volume, a tube must be allowed to fill with blood until the normal vacuum is exhausted. A tube that has prematurely lost all or part of its vacuum will fail to properly fill with blood. Now, what are the causes of premature loss of vacuum, okay, in your evacuated tube? So for premature loss of vacuum causes, first is improper storage. So for example, the storage temperature. So the temperature that is ideal in the storage of evacuated tube, it's from 4 to 25 degrees Celsius. Okay, 4 to 25. Another is the opening of the tube. So if you open the tube automatic, the vacuum kay mawala siya. Okay. Another is dropping the tube. So if ma-drop siya, then you cannot use that one for ETS. Maybe you can use that one for syringe method, but for ETS, it might not collect the exact volume. Okay. Next, advancing the tube too far onto the needle before venipuncture, or if the needle bevel becomes partially out of the skin during venipuncture. So, for example, you did not hit the vein in, after the insertion. You did not hit the vein. So next is to do probing. And while you're probing, you remove or you try to pull the syringe or the needle. Then accidentally, there's a portion of the bevel that it was exposed to the air. Then automatic, there will be a premature loss of vacuum from that evacuated tube. So those are the causes of premature loss of vacuum in our evacuated tubes. Then next, you have causes of underfilled tubes. So underfilled tubes or short draw. So causes, first, you have premature loss of vacuum. That's the first cause of underfilled tube. Next, removing the tube before the vacuum is exhausted, and stoppage of blood flow during the blood draw. So, for example, if the vein uh, yes, vein collapse. Okay, so there will be a stoppage in the blood flow, and that can cause underfilled tubes. Okay. Then next you have additives. So for additives, an additive is any substance placed within a tube or other than the tube stopper. So for additives, function is to prevent clotting. For anticoagulants, this is the function of anticoagulants, preserving certain blood components like sodium fluoride as antiglycolytic agent or anti-glycolytic agent. So it prevents glycolysis and to enhance blood clotting. So if you add clot activator like silica or thrombin, so it enhances, or those substances enhance blood clotting or blood coagulation. Okay, so the amount of additive in a tube has been calibrated by the manufacturer to function optimally and produce accurate results with the amount of blood it takes to fill the tube to the capacity or volume indicated. Then next, for non-additive tubes, very few tubes are additive free. So most non-additive plastic tubes that do exist are used for clearing or discard purposes only. Usually, uh, in the laboratory, the discard tube is usually made up of glass. So example, glass red stopper tube, that's a discard tube. No additive, no clot activator, but for plastic, it's with additive. But nowadays, there are some companies who manufacture or produce non-additive plastic tubes. And the reason for that is to avoid, or it's because of safety reasons. Because for plastic, I don't know, for glass, there's a possibility manggod nga mabuak. Okay? So, glass is a hazard, okay? A possible hazard. So that's why some manufacturer, they use plastic or to replace glass red stopper tube with plastic ones with no additive because of safety reasons. Okay? But there are still uh, um, um, glass red stopper tube that are available in the market. Okay, and for glass red stopper tube, it contains no additive. Okay, no additive, and that's no additive. So you'll wait up to 60 minutes for your sample to clot if you're going to use glass red stopper tube to collect specimen for chemistry. Okay. Okay, so next you have the stoppers. So usually it's made up of rubber, okay, rubber stopper. And tube stoppers are typically made up of rubber. Some tubes have rubber stopper covered by a plastic shield. So this one is an example of plastic shield, okay, to protect lab personnel from blood drops remaining on the stopper after the tube is removed from the needle and from aerosols and sprays of specimen when the stopper is removed from the tube. So the rigidity of plastic also prevents the removal of stopper using the thumb roll, okay, a technique that has been shown to cause aerosol formation. Okay, so that's the purpose of stopper and the plastic shield. Next is color coding. So tube stoppers are color coded. And for most tubes, the stopper color identifies a type of additive placed in the tube by the manufacturer for a specific purpose. So for example, lavender, the additive is EDTA. For light blue, it's sodium citrate. For green, it's heparin. Okay, so that's for the color coding and additive of your evacuated tubes. Then next, you have expiration date. So manufacturers guarantee reliability of additives and tube vacuum until an expiration date printed on the label, provided the tubes are handled properly and stored between 4 and 25 degrees Celsius. Improper handling or storage can affect additive integrity and tube vacuum. So if not stored properly, so for example, if the tubes were exposed to hot temperature or high temperature, then automatic that high temperature can cause deformity to the tubes and can cause it can also cause a problem with the vacuum and also the potency of the additive present in that evacuated tube. Okay, so which can lead to compromised test results or improper filling. Then always check the expiration date on a tube before using it, and never use a tube that has expired or has been dropped. Discard it instead. Okay. Okay, so next you have stopper color, additive, and department. Okay, so for light blue, the additive it's sodium citrate. It's 3.2% sodium citrate, and it's usually used for coagulation tests, or it's used for our coagulation studies. Then red, this is made of glass. The additive, it has no additive, and you can use this one for chemistry and ISBB or immunosero and blood banking. And you can also use this one as discard tube. Okay. The next is red. So it contains clot activator, which is silica, and usually used in chemistry. Okay. So between plastic and plastic and glass red stopper tube, the tube that will produce or will have early or much earlier coagulation, it's the plastic red stopper tube. So it will take about 15 to 30 minutes or 20 to 30 minutes for the sample to clot if you're using plastic red stopper tube. But for glass, it usually after 60 minutes or 60 minutes after collection. Okay. Another, you have red, combination of red and light gray. So it has no additive and usually used as discard tube. Then next, red, black combination and gold. It usually contains clot activator and the gel separator, the thixotropic gel, and it's for chemistry. Then for green and gray and light green, contains lithium heparin and gel separator. It's for chemistry also. Then green contains lithium heparin, sodium heparin, or ammonium heparin. It's for chemistry. Lavender, EDTA, same with pink, and it's for lavender, it's for hematology, and pink, it's for blood banking. Then gray, sodium fluoride and potassium oxalate, it's for chemistry. Regarding lavender, no, you can also use lavender EDTA for blood banking. Okay, so for example, cross matching. Okay, so usually the tubes used to that is lavender. Okay, but you can also use pink. Okay, next is orange. So for orange, it contains thrombin, and it's for chemistry, and it's usually used for stat purposes, because if you're going to use orange tube, the sample will clot the sample will clot 5 minutes after collection. Okay, so that's the characteristic of orange stopper tube. It contains thrombin, and thrombin accelerates clotting, or it activates clotting. So the specimen will clot within or 5 minutes after collection. Okay, so next, royal blue. There are royal blue with additive or without additives. And if it contains additive, it's either EDTA or sodium heparin. Now, it's for chemistry, and it's usually used for trace element testing. So, for example, copper and other trace elements, because royal blue is made of materials that is free of trace element to avoid contamination, because if there's trace element contamination, automatic you'll have false increase in your trace element. Okay, so trace gan isa, 'di ba? Minute amount lang. So if there's minute amount of contaminants or contamination, then automatic you have super high or abnormally high value of trace element. Then for yellow, it's either sodium polyanethyl sulfonate and acid citrate dextrose. But yellow with SPS, it's for microbiology. And yellow with ACD, it's for immunohema or blood banking. Okay? Then next, the syringe system. So sometimes used for patients with small or difficult veins and parts. You have the hypodermic needle. Then you have the uh, plastic syringe. Okay, so you have the needle and the plastic part of a syringe. Then for the plastic na part, you have the barrel and the plunger. So this is the barrel and plunger. Okay, barrel and plunger. Then you have the needle. Okay, so needles, syringe needles or hypodermic needles, the usual gauge is 21 to 23, and length of 1 or 1.5 inch, 1.5 inches, the length of syringe needles. Okay, then syringes or sterile pull-apart packages, available in sterile pull-apart packages, and they're also available in various sizes or volumes. The most common volumes used for phlebotomy, you have 2, 5, and 10 ml. Then syringe volume is selected according to size and condition of the patient's vein and the amount of blood to be collected. So for example, if the patient has small veins, then use 23. If the patient has normal size vein, then use 21. Now regarding the amount of blood to be collected, it depends on the test. So for example, if the request you have CBC and electrolytes, okay, electrolytes. So for electrolytes, you need red stopper tube. And for CBC, you have lavender top tube. Okay, so the usual volume CBC, it's 2 ml, and for a red stopper tube, it's 4. So 4 plus 2, that's 6. So you need to collect at least 6 ml of blood. So to collect 6 ml of blood, use a 10 ml syringe. Okay, so parts, you have the barrel, then the plunger, okay, and also the needle. Okay, so when drawing venous blood from syringe or by syringe, the phlebotomist slowly pulls back the plunger, creating a vacuum that causes the barrel to fill with blood. So that's the principle of a syringe. Then next, you have syringe transfer device. So blood collected in syringe must be transferred into ETS tubes. So in the past, blood was transferred by poking the syringe needle through the tube stopper, or by removing the tube stopper and injecting blood from the syringe into the tube. Both practices are now considered unsafe because for the first technique, poking the syringe through the tube stopper, you're increasing the chance of needle stick injury. And for the second technique, removing the tube stopper and injecting blood, you're increasing the possibility of exposure to blood. Okay, so to avoid those hazards, that's why there's a syringe transfer device. So this is the syringe transfer device. So it's like an adapter, but it has one-way needle lang, not a two-way needle. So you have a needle inside this one. This is the needle. And the purpose of this part is to connect this one with the syringe. Okay. And in this area, this is your tube holder or ETS holder or evacuated tube holder. So that's the setup. You have your tube, ETS tube, then you have your syringe transfer device and the syringe. So you can avoid needle stick injury or exposure to blood by using this device. Okay, so a syringe transfer device allows the safe transfer of blood into the tubes without using the syringe needle or removing the tube stopper. The device is similar to an ETS tube holder, like this one, but has permanently attached needle inside. And it's a one-way needle, it's not a two-way needle. So the transfer device greatly reduces the chance of accidental needle sticks and confines any aerosol or spraying of the specimen that may be generated as tubes are removed from it. Okay, so that's the purpose of your syringe transfer device. That's the best or ideal way or method of transferring blood from a syringe to an evacuated tube by using a syringe transfer device. Okay, so next type of needle, you have your wing infusion set or butterfly infusion set. So it's for collecting blood from small or difficult veins such as hand veins and veins of elderly and pediatric patients, as it allows much more flexibility and precision than a needle than a multi-sample needle and syringe. So regarding elderly and pediatric patients, usually for pediatric it's small, and for elderly it's uh, there's a possibility that the vein will move. Okay, so for you to have hiring a possibility to collect blood, it's better to use wing infusion set. Okay, so 1/2 to 3/4 inch stainless steel needle permanently connected to a 5 to 12 inch length of tubing. This one, okay, and usually it's attached to an adapter. Okay, so you're one of the components of ETS. Then next is you have your evacuated tube. Okay, so this is the setup for butterfly infusion set. And in the collection, okay, of blood using butterfly infusion set, so first is in the order of draw, in the collection, you need to use a discard tube first before you follow the correct order of draw, diba? Light blue, then red. So first tube is a discard tube. So a um, glass red stopper tube. So the purpose of the discard tube is to eliminate the air present in the tubing. Okay, so to eliminate the air or to remove that interference, that's why you have a discard tube. After the discard tube, then fill the tubes or follow the correct order of draw. Okay, so light blue, red, and so on. The next, butterfly needles come in various gauges, although a 23 gauge needle is most commonly used for phlebotomy. In rare situations, a 25 gauge needle is used by specially trained personnel to collect blood from scalp or other tiny veins of premature infants and other neonates. Using a needle smaller than 23 gauge, it increases the chance of hemolyzing the specimen. That's why it's rare in the hospitals to use gauge 25 needles in the collection of specimen or blood specimen, because it's likely likely to collect blood that is hemolyzed. Okay, so those are the uh, equipments and supplies. Next video or meeting will discuss the additives present in evacuated tubes. Okay, so those are the general equipment and supplies in routine venipuncture or phlebotomy. Okay, so thank you.